So as we say in France, this is the last straight line before the end, so I hope you are not too tired. So it's still the same topic, but this time with a different kind of data. Leonardo Heyerdahl, who is an anthropologist, will talk about what healthcare workers write about vaccination on Twitter.
Soit l'autre, soit celui-là, mais il faut l'allumer.
Ouais, ça marche? Ouais, merci. Thanks, Patrick. Yeah, I cheated a little bit because I changed my title. There's a bit of a discrepancy between what was promised and delivered, and I'm sorry. But yeah, so basically so maybe as a starters, so generally we're interested in what is said online. Because, well, as we know with the topic of infodemics and so on, there's the notion that a lot of public opinions are formed now partially online, and that it influences vaccine confidence and so on. And among healthcare workers, we found that listening to what was said online was particularly interesting, because there was this phenomenon that we tried to study of unspoken vaccine hesitancy, and with healthcare workers who had kind of sometimes a double speak regarding vaccines, that would at beginning of interviews say, oh, I have a hard time to vaccinate my patients, they don't want to listen, and at the end they tell you how they try to avoid the vaccination day because they themselves don't really. So and some of them telling us, you know, I don't talk about vaccines with my colleagues, or I pretend to be pro-vaccine, but then when I go online, I can find relatable others or people I can talk to. So working with online data, yes, it's big data, it's thin data many times, because it's only a small portion of text. You don't know who's talking, you don't know if it's a human or a robot, you don't know if they're going to act according to what they say online, but in combination with other approaches, grounded approaches, it can give you a broader picture, and sometimes you can get online what you don't find so easily offline. Yeah. So just as a preamble, maybe. So we've been interested within the ACME project, among other that we're working on with Judith and Pierre. I've been working with a colleague, Gaston, in trying to characterize the discourses regarding vaccines on Twitter. And we try to have kind of 4 domains that we're interested in. One is the vaccine narratives, which kind of relate to the attitudinal roots a bit, the emotions. I had initially said I would talk about emotions and narratives, but it's too much for one presentation, and emotions are actually quite tricky, it seems. We also want to talk about the type of actors that people talk about regarding vaccines, and the user intent, or the reason why they're speaking online. Are they trying to convince someone? Are they refuting something? Are they making a call to action? And so on. So today I'll just talk about narratives. So regarding the Twitter, now X, database, we've been collecting tweets daily since February 2020. There was a gap when Elon Musk arrived and he pulled the plug and he kicked all the researchers out of Twitter. We regained access, and now we're trying to consolidate the missing months. We have more or less 12 million original tweets in French regarding vaccines. And we've been using it in several projects with the Red Cross, with the European Recover Project, with the Unspoken project in Belgium, always trying to triangulate with interviews and questionnaires to see just how these narratives resonate with individuals, or their prevalence through surveys to see, you know, how many people in France think there is a microchip in the vaccine. We found like 12%. But so we always try to do it and integrate it with other approaches. So what I'm doing today is a bit of an exception. I'm talking just about the online stuff. So in the Twitter database, what we did is we used the open text for bio, and we used the nomenclature of medical professions in France, and we identified all of those who said that they were a healthcare worker. And out of the maybe 10 million tweets that we have 94,000 tweets more or less between 2020 and 2023 of people who self-identified as one of those professions. So I'll be talking about this database today. And for the narratives, we made this taxonomy, which is heavily influenced by the health belief model, the 5C, the 7C. I also took the naming conspiracy ideation from you, Don, which I found a nice way to put this. And basically, we hand-labeled around 600 messages. It was an inductive and deductive coding. So we started with a taxonomy, and as we confronted it with the data, we added new labels, we merged them, and so this is the result of, after doing more or less the 600 and reaching saturation. It's not set in stone. We can still change it. We want it to be also useful beyond COVID. And there's the classical things we're interested in is perceived safety, usefulness, accessibility, the susceptibilities and the pathogenic risk. In usefulness, we merge the perceived efficacy with the relative efficacy, so people can agree that the vaccine is has an efficacy, but they say, but there is hydroxychloroquine, so it's not useful, right? So we merge those things. And then there's the lower parts are more about how people kind of interact and their attitudes towards others. So there's polarization. So we try to identify when people are criticizing anti-vax as being stupid, as being immoral, as not caring about others' safety. We try to do the same with the criticism of pro-vax, of people saying, well, you're just gullible, you just believe you're a sheep and so on, or you are dangerous to others because you think you're protected by the vaccine, So we try to see just how polarized the discourse is. I added like unsanitary other, which is more like xenophobia, like saying, I hope the people coming from outside are vaccinated because, and so on. And a bit the de-escalating. So when people are saying, okay, let's calm down, I'm not trying to attack you, I'm trying to understand you. So just trying to see if people are trying to calm things down or not. And then we have, I won't go into all, but basically it's trust. In like around conspiracy ideation, there's also the vaccine profiteering. And then on the legitimacy of mandates or other, there's the reactants. And then there's people who say, well, actually, we should push the obligation. It is legitimate to put a vaccination pass and so on. So we try also to code that. And then the last category, information, you have like generic information, like Pfizer is testing on phase 3 their vaccine, and it's just neutral. And then there's the candid question is like, I'm pregnant, 4 months. Should I get the vaccine or not? And it's people who are really looking genuinely for information and trying to know more about the vaccine and vaccinations. So we, as I said, we hand-labeled 600. We only have 93,000 to go. So how do we proceed? I'll try to go quickly. Machine learning can help us here. We've gone through, in the last 15 years, to a lot of changes. So we had the classic text mining, which used bag-of-word techniques, term frequency, inverse document frequency, which are kind of rudimental now. Bag-of-words is like all your vocabulary within your documents, and you have 0 and 1s for each message, for instance. So it's huge sparse matrix that can kind of give you an idea of what is said inside. But to use those techniques, they were moderately accurate. You need several thousand of examples per class to do something. Moving on to word embeddings, this is a more advanced form of vectorizing the meaning. So each word is a vector, and it's like as a star in the system. So the planet dog and the planet cat are going to be together. Salt and pepper are going to be together, and chicken is going to be in between, because chicken can be an animal or it can be in the kitchen. So words have vectors depending on their proximity, and so it's a much more efficient way to encode meaning. And with that kind of models, we had improved accuracy, but you still need hundreds of or thousands of examples per label to have any kind of meaningful model. And then, since 2018, we've had models like transformer-based models like BERT and Camembert in Français, which are very, very accurate, but they still need hundreds or thousands of examples. So we have 29 labels in our taxonomy. By 1,000, that's like you have to code at least 29,000. And some of the labels are very rare, so you would need to code even more to reach those smaller, so it's like unfeasible unless you're Google and you can pay, people in overseas, underpay them to label 200,000 messages. But we don't want to do that, and we cannot do that. But since 2020, there's a new player in AI that we could use, and it doesn't require examples really. I don't know if you know who I'm talking about. Right, large language models, ChatGPT, artificial intelligence, and so these are models that the accuracy can be moderate to very high, but they're very slow in delivering their results. But they don't really require so many examples. So for instance, you can just ask ChatGPT, like, this is a message, do you think this is reactance or not? 1, if it's reactance, 0, if not, and then you can make a database like that, or you can do in a few shots, so you give it 3 examples of what reactance is, and so it's much easier to do that like that. So before we jump into the hype train, there are a few things that we need to do, I think, as researchers, is to keep our autonomy when we use these large language models. So these are meant to augment our capacity, but not to replace it. So we give it a taxonomy that we've decided upon, and we need to be able to evaluate just how accurate it is on our own qualitative coding. Also, we don't want to use closed models like ChatGPT, Gemini, and Claude, because we don't want to give our data to them, and we shouldn't. And so we use open source models, which are less efficient, but at least we know things stay with us. And so we've tried several models. The best one right now is Llama 3.3. We've kind of worked through the model's error, like I would normally with junior anthropologists, like, let's sit down, why did you label this like that, and so on, and see the weaknesses of our definitions. And sometimes when it over-interprets a word, that it tends to have too many false positives to label things too much. And so now, well, a week ago, we managed to stabilize it with a F1 score of 0.79 across the 29 labels. And so we launched it to label our data set of 90,000 messages. I was only able to get 20,000 labeled in the last week. But so basically, this is, out of the 20,000, we've got 2,600 users. Most of them are doctors, medical doctors. Then we have nurses, and then we have physiotherapists. So there's an overrepresentation of medical doctors, and we don't know if it's because it's a desirability bias or like a status-based thing, or that maybe specialists don't really put their specialization and they just say medical doctors. But so, And of course, this is Twitter, so it's not like representative. Basically, when we regroup all the labels which are very negative and very positive, we see this, that there's much more vaccine confident messages among healthcare workers, but you still have some vaccine skeptical messages. But the thing is that vaccine skeptical messages get a lot more traction. So they have like 7 times more favorite counts. They have much more retweet counts. So they could still have a bigger influence even though they're minority in the data set. Then we try to see how it is distributed by healthcare profile. And we see something that we already see in the literature, and is that, for instance, medical doctors tend to be more confident than nurses and medical assistants, but not as much as maybe we would have anticipated from the literature. And that on the bottom, you see like resuscitator, geriatrician, and oncologists are overwhelmingly positive. And yeah, I mean, I guess it's because they deal with people who could be very heavily impacted by those who don't vaccinate, so they have this urge to push more vaccination and vaccine-confident topics. In the least vaccine-confident, you have cardiologists, maybe because they're discussing myocardia and things like that. But then, you know, it's the limit of the thing is that, is someone discussing possible and documented side effects as being vaccine hesitant, or is it just reflecting, you know? So that's, I think, yeah. So mostly the discussion was, like the vaccine confidence discussion was about the vaccine being useful or not useful, that COVID was risky. We see also that in terms of polarization, it's mostly people complaining about the anti-vax, refusing to vaccinate and so on. There's a bit about complaining about the pro-vax. In terms of trust, I divided trust between those who were skeptical and confident. And so the vaccine skepticals showed distrust towards powerful actors, so institutions, media, politicians, but very few positive trust towards them. And well, among the confidence, there's a bit of discussion of displaying trust towards those, but still a bit of criticism that is there, but not in the same kind of radical form. So just the distribution over time, we see that we have a spike around 2020 July. And this is also when there were some concerns and where vaccine mandates were starting to be discussed for healthcare workers. In July, it's the July 12 that Emmanuel Macron announced that it would be mandatory for healthcare workers. And so we see that there's a spike of discussion and people saying that it's useful, trying to make the case. For accessibility, we see that there were some concerns early on, but it kind of quickly faded. In terms of the time distribution of trust is also so we have less of those, but in terms of polarization, the criticism against anti-vax was also predominantly the spike is when there was the mandatory announcement. So it feels like kind of enforcing or going in the sense of what is announced, and the peak of reactants also that you see here is also in between July and September, and in September it was the moment when it was enforced and people were losing their jobs, and it's one of the moments where reactance was higher than the narratives that justified the coercion. Right. So this is very preliminary. We're still trying to make the models better and to code more, label more data. Big data is thin data, so we need to triangulate these findings. We will be starting a French version of the Unspoken project so here in France that we did in Belgium, where we will be exploring vaccine sentiments among healthcare workers, climate of vaccine discussion with peers and with patients, and where we will also try to do a co-construction of vaccine dialogue. And for that, Paul is going to work on the anthropology. We also have a colleague in epidemiology who is going to work on the representative survey to analyze this at a national scale. Yeah, and so it starts next month. So yeah, hopefully we can have next time a more integrated presentation of polarization and discourses and how vaccine sentiments evolve and are communicated between online and offline. Yeah, thank you.
Thank you very much. I can take the first question because I'm holding the micro. Just as I'm not very I don't use this kind of method. So just one point. What is an organic tweet, please?
It's just an original tweet that someone wrote. It's not a retweet. Okay. So it's not a copy of someone else. So it was like 12 million original tweets.
Okay, so, and now a true question. I think that you showed that people who were healthcare workers who were reluctant to get the vaccine were prone to express distrust toward the authorities or other actors of the vaccination campaign?
This?
Yes, trust among skepticals, trust among...
yeah, so this is among those who have vaccine skeptical discourse. So not trust actors, so they don't trust like official institutions and so on. Or prominent actors.
And among confident...
and this is among those who have otherwise positive, they will say that the vaccine is useful, the vaccine is safe. They will say that they trust institutional actors, and some of them will say that they don't trust. Yeah.
Okay.
Yeah.
And have they the same arguments? Because I understand that those people who are skeptical may be especially prone to express distrust, but I guess that those who agree with the vaccination campaign may not necessarily express a high level of confidence anyway.
Yeah. So the thing is, trusting actors, we didn't specify that it's like health authorities, or it can be like the problem is that people can distrust vaccines, but they can trust or distrust like the scientific official world, but they will say that they trust Raoult or they trust other
They trust science.
Yeah, but they have maybe a different definition of science, right? So this is why we try not to be normative about it's trusting kind of high-level visible actors. So I was thinking that we would see more of trust actors among the skepticals, because sometimes they will really say that I trust this the scientists who said the vaccine is not safe and so on. And so, but we haven't looked into exactly the kinds of actors that are in each categories yet. Yeah.
Okay. And as you said, big data are also thin data.
Yes.
We we lack information, especially regarding the characteristics of people who tweet. Is there any kind of other source of data that may allow you, for example, to say that in this age range, healthcare workers are prone to go to Twitter, in other age ranges? So are there other sources of data? Surveys investigating the whole population, but in order to know which category is prone to using Twitter.
Oh yeah. There is a report about it's Statista, I think, that does the segmentation of demographics by social media platforms and so on. And so we know Twitter, like 2020, 2023, it was still Twitter. It was predominantly highly educated, more male than female, 30 and above, and so on. So yeah, it's not representative today, even less so, of course.
You can find data.
You can, yeah, yes. Yeah.
Question.
Si, c'est juste que je parle très bas.
Yeah.
So thank you very much. Very interesting indeed. Just one methodological question.
Yes.
The fact that cardiologists are ranked first among the vaccine skeptical is probably a bias due to their discussion on myocarditis as a side effect.
Yeah.
So how do you foresee the improvement of the model? I mean, can you, how do you have any solutions to ensure that I'm right or not, and how to improve it?
Yeah. So that's a big question, and the problem is that things can be true at a given time and then they're false later. So if you talked about thrombosis in January of 2021, you were complotista. If you talk about it in April, you are right. So, like, our definition of what is okay, discussing an adverse event, but that is legitimate. For a 3-year period, it's difficult. So this is a wicked problem, I think. I don't know exactly how we would, but we need to have a better definition that makes a separation between saying the vaccine has a problematic health outcome, but that is still not into the vaccine skeptical, but just being transparent about rare occurrences, but that are documented. So it's a wicked problem. I think we need to see, but yeah.
Well, thank you for the talk. It's really fascinating. I've got 2 questions. So the first is about the polarization that you saw and how how it was more criticizing anti-vax than criticizing pro-vax. And I wonder how much of this might be a function of there being more pro-vax than anti-vax tweets.
Oh yeah. Yeah, I think several things. Predominantly, I guess that the healthcare worker population in Twitter in that period was more confident. So definitely, I guess it's normal that it's a size effect. The other thing is that at that time, there was more control maybe not in criticizing pro-vax, but some of the vaccine reluctant or anti-vax discourse was kind of taken down, so or decelerated or discouraged, and now it could be the opposite. I think we have the databases from 23 to now, and I think it would be interesting to see, because I think it's the opposite now, that you are authorized to criticize, and if you try to defend, it may be completely so. But I think the criticizing anti-vax is more an effect of them maybe being more than being more virulent, I guess, or I mean, but it's maybe too early to say that. Yeah.
Thanks. And my second question is kind of about what you said about the co-construction of dialogue initiatives.
Yes.
And could you say a little bit more about that? Because I'm interested in, for example, on social media, do you sort of foresee this as, say, people responding to tweets in a sort of constructive manner?
Yeah. No. So we back in 2021, 2022, we had a funding by Vaccine Confidence Fund funded by Facebook. So they try to fund research and initiatives that I think their bias was to show that social media can be used in a positive manner, including to foster vaccine confidence and so on. And so we were looking at unspoken vaccine hesitancy. We were trying to see how healthcare workers discuss or don't discuss vaccines, and how we can restore dialogue between, and that this was during the Omicron phase, and how we can restore dialogue between people who are kind of yelling at each other, right? And so we did interviews and focus group discussions with healthcare workers of all kind of vaccine tendencies, and said, do you think it's a good idea to do that? If so, how? And our idea in our proposal was we're going to build safe spaces so they can discuss anonymously online and so on. And they told us, no, why do you want a safe space? Do you want society to be safe from us because of what we're going to say? You want to put us in a cellar? No, we want to be able to express ourselves freely. Why do you want to do a safe space? I want to have someone in front of me to have a genuine conversation. And so we were kind of wrong in our assumptions. And what we did is we had a web platform in Discord where people could engage anonymously and by text and so on. But we also have live session with deep democracy experts, that works on civil conflicts. And they have this, it was Omicron, so we couldn't do it in person, but through Zoom calls, we could do sessions between like pro-vax and kind of vaccine skeptical or anti-vax, and trying to find, trying to understand how the others are, why they're concerned and so on. They have these techniques in deep democracy, and to try to find a common ground. And the result was quite positive because people were lacking this ability to engage with the other without having the potential cost of a professional relationship or your job. And so, and we published this, it's called Embracing Context. And so it's a reflexive piece about how we try to co-construct dialogue. It's inspired by the motivational interview, but it's among healthcare workers. Yeah.
Thank you. I'd love to pick your brains more on it, but we'll talk later.
Yeah.
So the last intervention will be a two voices intervention.